Biological antisepsis is used for treatment and prophylaxis of purulent infection. Usually, biological antisepsis use the administration of several types of antibacterial compounds, such as antibiotics, biological antiseptic compounds, such as proteolytic enzymes, immune stimulators, and immune compounds. Biological antiseptic compounds, such as proteolytic enzymes, can dissolve necrotic tissue, fibrin, pus, prevent edema, and enhance the therapeutic effect of antibiotics. They are divided according to its source. They can be animal source, bacterial source, or plant source. Usually, proteolytic enzymes can be used topically or systemically. Immune stimulators are compounds that stimulate immune system. They are divided into active, such as anatoxins and vaccines, and passives, such as antitoxin, serum, and immunoglobulins. Antibiotics are the largest group of agents of a biological parentage. They can be divided into several groups, such as group of penicillin, that can be subdivided into natural penicillin, semisynthetic penicillin, group of tetracyclines, group of aminoglycosides, group of cephalosporins, and group of uridopenicillins. Each antibiotic has a spectrum of action. Some antibiotics can act more effectively against gram-positive or gram-negative bacteria. Therefore, it is important to take in account which is the type of microorganism present in the wound infection that is being treated. Let's pay attention to some points about antibiotic therapy. Indications. Antibiotics should not be prescribed unless they are indicated. Antibiotics are meant to supplement treatment rather than replace surgical management. Contraindication. Underestimating the contraindication for antibiotic therapy can result in serious complications, such as promoting super-resistant microorganisms to drugs, and also they are not indicated in case of viral infections as well as in case of patients with allergy to the medicament. Dosing. The minimum inhibitory concentration is the least amount of drug necessary to inhibit visible growth of 24 hours. Lower amount of the drug do not cause antibacterial effect, and microorganisms acquire resistance to the antibiotic. If, on the other hand, the concentration of the drug are too high, in addition to its antibacterial effect, it can cause a number of adverse effects. The duration of antibiotic therapy. The duration of the antibiotic therapy depends on the rate of inhibition of inflammation and the normalization of body temperature. The course of treatment in acute infection is about 5 to 7 days. Go to the patient room, present yourself, identify the patient, explain the procedure that will be done. After that, wash your hands with soap and water and apply a disinfectant solution. Check the medical prescription, the name of the medication, the patient's name, the hour and the dose that should be applied. After that, gather all the supplies. After that, put on mask, goggles, gloves. Prepare the medication that will be administered to the patient. Clean the ampoule and the saline solution with alcohol 70%. Then, open the syringe package and connect the syringe with the needle. Aspire carefully the medication into the syringe and then the saline solution. Open and clean the cap of the cannula with alcohol wipe. Then open the clamp. Apply the medication to the patient carefully. After that, we need to flush the cannula with saline solution. Now, infuse saline solution into the cannula. Close the cap and monitor the patient's vital signs in sign of problem.